Hi everyone, now we are going to discuss about the pregnancy. What is pregnancy? Okay, pregnancy nothing but gestation period. Gestation period means what? The development of embryo, development of after formation of zygote changing into baby, conversion of zygote into baby. It will be take some period, gestation period. Okay, that gestation period, that development period of embryo, okay, that development uterine development of embryo or fetus is called pregnancy. Pregnancy is nothing but development period of embryo or uterine development of embryo. In uterine embryo development we can call pregnancy period. Generally pregnancy period approximately normally, okay, 280 days are nothing but 40 weeks. In summer 236 days or okay, and 38 weeks also. Okay, based on the body female, and especially for generally the pregnancy period is what 280 days or 40 weeks. That is the development period of fetus we can call pregnancy in mother womb, in mother uterus. Okay, what the development of uterus or development of embryo we can call that is pregnancy in mother womb. Okay, in generally pregnancy averages 266 days in somebody, 38 weeks, generally in all or most of them 40 weeks and 280 days. Okay, these 280 days how they calculate means what? Last of menstrual phase, LMP, last of menstrual phase after 40 weeks. Okay, in 40 weeks, that is the period we can call especially for pregnancy period. In pregnancy divided into 3 steps, generally 9 months, they are divided into 3 steps. 3 months 1 step, 3 months 1 step, 3 months 1 step, generally 9 months. In the 3 steps, pregnancy divided into 3 steps we can call 3 trimesters. 3 trimesters. That means they divided into 3 month 1 period. First trimester, second trimester, third trimester. First trimester, second trimester, third trimester. After third trimester, the pregnancy, the development of total embryo is developed in female uterus. Okay. In first trimester, which period we can call first trimesters? That is the first 3 months. Generally, first 3 months. Okay. First week to end of 12th week. That means which period we can call first trimester? First week to 12th week. Okay, approximately 3 months. Okay, first week to end of 3 months we can call first trimester. Second trimester 13th week to 26 weeks. Remember, second trimester period is 13th week to 26th week. And third trimester period is 27th. Okay, third trimester 27th week to end of the pregnancy. That is what? End of the pregnancy, that is third trimester. In first trimester, what is the first trimester? First 3 periods. Sorry, first 3 months. What will be happen actually? Especially the end of the 3 months, the baby is what 4 inches long. Fetus is 4 inches long. Weight is less than 40 ounce. And in that, in first end of the 3 months, what are the organs are developed? Nervous system, heartbeat, arms, fingers, legs, toes, hair and teeth bulbs are developed at the end of the first trimester. And one more important point, if you want to hear the sound of heartbeat rate within third month, the end of the third month, we are possible to hear the sound of heartbeat rate. Okay, this is the first sign. Now, if you want to listen the heartbeat sign when the carrying pregnancy going on in within third month, the heart is beating within third month. The end of the third month, we are possible to hear the heartbeat rate. And second trimester. In second trimester means what? That is generally 4, 5, 6 months. Okay, the period is 13th week to 26 weeks. That is we can call second trimester. In second trimester, lot of physical changes happens. The baby also little bit grown. In first trimester is less than 1 ounce. Second trimester it is 1 to 2 pounds of weight is increased. And in female, what are the symptoms we are observing mother who are pregnant lady at the time of second trimester? And uterus expands, increasing the size of belly, growing belly and breast, skin changes, some nausea problems, dizziness, leg cramps. We are observed. These are the symptoms we are observed in female who are pregnant lady. In pregnant lady, lot of changes occurs in pregnant lady symptoms also. Okay, what are the uterus expands, growing belly and breast, and skin changes, nasal problems, dizziness, and also leg cramps also we are observing second trimester in who are pregnant. In third trimester, the period is what 27th month to 27 weeks to 40 weeks. Okay, in 29 to 40 weeks also gain more weight and baby will open his eyes, open his or her eyes at the time of third trimester. That means the totally baby is formed within third trimester. The end of the trimester, third trimester, the total body is formed. Okay, total all organs are formed in female in uterus. Okay, the baby fully developed. Okay, in after that one, after development of baby and parturition is occurs. That means what? Delivering of baby. Okay, in through with vaginal openings. That is we can call parturition. Okay, next one we have to discuss about lactation. After parturition, what will be after delivery of the baby? Then in female, the lactation will be starts. What is lactation mean? Production of milk. Simple. The lactation meaning is production of milk, secretion of milk from mammary glands. Especially at the time of pregnancy period, the breast size is increased, and also what mammary glands also differentiations and produce what milk, mammary glands. These production or secretion of milk from mammary glands is called lactation. Very, very important. What is the meaning of lactation? Production of milk or secretion of milk from mammary glands is called, that is lactation. Okay, what are the causes of lactation? Generally, the lactation, production of milk, secretion of milk from mammary glands, in pituitary gland, prolactin hormone is there. Prolactin and oxytocin hormones. These two are play the major role of lactation. What are they? One is prolactin and oxytocin hormones are, they play major role the production of what? Lactation. That means production of milk, secretion of milk from mammary glands. And also estrogen is also indirectly involved in lactation. That means prolactin and oxytocin directly involved in lactation, estrogen indirectly involved in lactation. In lactation, the production of milk after mammary glands differentiation and produce what? Milk. Okay, it starts from producing milk. Okay, milk produced during initial means starting days. Starting days after delivery, the initial milk. Initial means what? Starting the mother producing milk. Whatever initial milk produced during initial days, starting days of lactation is called, that milk we can call colostrum. Very, very important. What is colostrum? Milk produced during initial days of lactation. Milk produced during initial starting days of lactation is called colostrum. In recently doctors told us this colostrum, whatever initial milk, starting milk, initial milk, it contains lot of antibodies. So that it is compulsory the baby need to feed that milk, whatever initial milk. Why? Because it contains lot of what? Antibodies. The antibodies useful to kill what? Antigen, which are microorganisms which are cause of infections to the baby. So that, and also it increases the immunity power also. Colostrum contains what? Antibodies, and also useful to improve the immunity development in baby. infant. Okay, so that what colostrum is what? That is the initial milk, which is the starting milk. Milk produced during initial days is called lactation, is called colostrum. Colostrum is produce antibodies and it is useful for improve the what immunity develop. These antibiotics are useful for to prevent the infections of the baby. Okay, thank you.